Ever heard of your liver messing with your breathing? Do you know your liver has a best friend forever in your body? Yep, it's your lungs. They work together to keep you healthy. But sometimes, when the liver is sick, it can cause problems for the lungs too. This can lead to something called HepatoPulmonary Syndrome or HPS. Imagine your lungs are like balloons. In HPS, these balloons don't inflate properly because the blood vessels in them get all wonky. It's like someone let all the air out. This makes it hard to breathe, especially when you're lying down. But don't worry, it's not contagious like the flu. In this essay, we'll learn more about HPS and how doctors can help. It all starts with understanding what HPS is and how it affects us. So, what exactly is this HPS thing? HPS is a condition where people with liver problems have trouble getting enough oxygen. It's like trying to breathe through a straw. This happens because the blood vessels in the lungs don't work properly when the liver is sick. You see, our liver is like a giant filter that cleans our blood. When it's not working correctly, bad stuff can build up and affect other parts of our body, including our lungs. This can lead to shortness of breath, fatigue, and even bluish skin. But how do doctors figure out if someone has HPS? Let's find out. How do doctors know if you have HPS? It's like a detective story. Diagnosing HPS is like solving a puzzle. Doctors use different clues to figure out if someone has it. First, they'll ask you about your symptoms, like if you have difficulty breathing or feel tired all the time. Then, they might listen to your chest with a stethoscope, which is like a special microphone for your heart and lungs. They might also order some tests. One of these tests is called a blood gas test. It checks how much oxygen is in your blood. Another test is called an echocardiogram, which uses sound waves to create pictures of your heart and the blood vessels in your lungs. It's like taking a peek inside your body without actually opening it up. By putting all these clues together, doctors can determine if you have HPS. Now, let's learn some interesting facts about this condition. HPS, not so fun facts and figures. HPS is more common in adults than in kids. And while it can happen to anyone with liver problems, it's seen more in people who have a specific type of liver disease called cirrhosis. HPS isn't contagious, so you can't catch it from someone else. The exact number of people with HPS is unknown, but experts believe it affects a significant number of individuals with advanced liver disease. Unfortunately, there's no cure for HPS yet, except for a liver transplant. However, treatments are available to manage the symptoms and improve the quality of life for those living with it. Remember, if you or someone you know has liver problems and experiences unusual shortness of breath, it's crucial to consult a doctor. Early diagnosis and treatment can make a big difference.